As the country experiences another surge in COVID-19 cases, the Department of Health notes that majority of the new infections are mild to moderate. And as a result, home care is usually recommended for these patients. And as with any medical condition, understanding the safe use of over-the-counter medicines is essential and can make a huge impact in recovery. On the program today, we'll talk about what you can do at home if you experience flu-like symptoms and what medicines we should all have in our cabinet. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk right here on CNN Philippines. Many of us turn to over-the-counter medicines to find relief from conditions like headaches, fever, muscle aches, and now COVID-19. Our guest is here today to tell us more about the safe use of them, from correct dosage to expected side effects. With us is Dr. Theresa Joy Santo Domingo, who is an emergency medicine specialist and director of emergency medicine at VRP Medical Center. In just over a few weeks, the Omicron variant caused the Philippines to reach a record high number of COVID-19 cases per day. And we continue to learn more about these new variants. So let's talk about what we know so far about Omicron. Dr. Joy, what can people expect as opposed to the Delta variant?
The Omicron variant has about 50 different mutations, and those 50 different mutations enable it to do several things. Number one, it enables it to spread faster. Number two, the Omicron variant evades certain antibodies that are produced by the vaccine. And this makes the vaccine less effective against the Omicron variant as compared to other variants.
New infections of Omicron here at home are usually mild to moderate. Is Omicron really causing milder COVID than, say, Delta? And are there any distinct symptoms of the variant? Something that was probably here now that wasn't there during the Delta variant surge?
Well, it's very difficult to tell the Omicron variant from the Delta variant symptoms. As usual, as we've seen, it still presents with the common features of the common cold, such as fever, runny nose, cough, difficulty of breathing. However, certain studies have shown that the Omicron variant tends to show with sore throat or an itchy throat, lower back pain, muscle pains, and nasal congestion. More on those characteristics or those symptoms compared to the other variant.
Is there any way to tell it apart, Dr. Joy? Tell apart whether this is just allergic rhinitis, if this is a cold, or if I have the flu, as opposed to it really being COVID?
It's very difficult to tell whether it is just the common flu or if it's signs of COVID already. So what we suggest is as soon as you start to show signs of having COVID, such as fever, cough, or cold, you begin to isolate already and take a test, whether that be the antigen, as a preliminary test, or the RT-PCR, which is the confirmatory test.
While it's reassuring that cases are mostly mild to moderate so far, we want to remind you that we should not let our guard down. What precautions, Dr. Joy, do we still need to take to protect ourselves from this virus?
So you should avoid crowded places, number one. Number two, avoid close contact with other individuals. Try to keep a distance of at least 2 meters or 6 feet away from each other. And three, avoid poorly ventilated areas.
Dr. Joy, since the start of the pandemic, experts have reiterated that masks can significantly reduce your chances of catching the virus. With the more contagious Omicron variant, are high-quality masks able to make a difference? Before, it was okay to wear cloth masks. Is that still the same case now with Omicron?
So there are different levels of masks that you can wear that offer different levels of protection. The regular cloth masks that are only made of one layer of cloth are not as effective in protecting you against any of the variants of COVID. So the more layers, the better. The double layer cloth mask, if you're going to use a cloth mask, is the best one to use. Next would be the KN95 or the surgical masks, which offer a higher level of protection against the smaller molecules or smaller particles of Omicron or different variants. And the highest level of protection is offered by the NIOSH approved respirators, such as the N95. But usually these are given to the healthcare workers.
Dr. Joy, for the regular folk, trying to go to work, do you still recommend a double cloth mask or for that matter, or a KN95?
It depending on your exposure. If you're exposed to crowded areas, if you're going to be in close contact with other people, I suggest either the double cloth mask or in higher risk areas using a surgical mask or the KN95.
Ultimately, prevention is the best cure. So wearing your mask, practicing social distancing, getting vaccinated, and encouraging your friends and family to do the same will go a long way in preventing the transmission of COVID-19. And if you start to feel any warning signs, stay at home and isolate right away. Now, Dr. Joy, partly because the majority of cases being seen are mild to moderate, there's an emerging thought process of getting COVID, getting infected with COVID to be part of the quote-unquote COVID club, or getting infected in order to recover and get it over with. They justify this by getting infected with COVID in the wild. You get the antibodies that are stronger than the vaccine or any booster. What is the danger in thinking like this? What can this lead to?
Well, the latest studies show that the Omicron variant even infect you, even though you've been already infected with COVID. Actually, it's 5 times more likely that you can be reinfected by COVID with the Omicron variant as compared to the other variants. So even though you've already had COVID, it doesn't necessarily mean that you can't get COVID again with this Omicron variant circulating.
What do you say to those who feel like they're strong enough, they eat healthy, they work out, they would like to be infected with COVID just to get it over with to move on?
COVID is still very scary. It's very unpredictable, especially if you have other comorbids such as hypertension or diabetes. COVID could range anywhere from mild to moderate to severe, and it could hit you either of those ways. Either it could hit you strong or it could hit you mild. It's hard to tell which way it will hit you. So it's best to take protective measures for you not to get COVID instead of waiting to get COVID and seeing how it affects your body and your system. I'm hoping everybody can get vaccinated because we do have tools against Omicron. And our tools are number 1, to wear a mask, number 2, to get vaccinated, and number 3, to get your booster shots. And stay safe, everybody.
Thank you very much, emergency medicine specialist Dr. Theresa Joy Santo Domingo, for joining us today and sharing your expertise and insights. Now, using over-the-counter medicines can help ease symptoms like fever, headache, and body pains. But knowing what to take and when to take them can speed up your recovery and, more importantly, keep you safe. We'll talk more about this with registered pharmacist and TikTok edu creator Archie Larga when we return. You're watching MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. There's so much information out there about COVID-19. It can be very overwhelming, and some of the more scientific aspects are hard to maybe understand for some. One content creator is doing his part to help spread awareness.
Maraming tao ngayon ang may lagnat, sipon at ubo. Kaya ito pong ilang paalaala mula sa inyong pharmacist. Let me explain. Ang paracetamol po ay iniinom every 4 to 6 hours kung kayo po ay mayroon lagnat, pananakit ng katawan o pananakit ng ulo. At sa loob ng isang araw, maaari ka lamang po uminom ng 4 hanggang 6 na tabletas ng paracetamol. And most importantly, uminom po tayo ng maraming tubig at mag-ingat at patuloy na gumamit ng mga face mask.
Joining us now is Archie Larga. He's a registered pharmacist and TikTok edu creator with over 2.4 million followers. Now that cases are rising again, I'm sure a lot of people want to know more about home care treatments, lalong-lalo na para sa COVID-19. Let's talk about over-the-counter medicines for mga simptomas na karaniwan parang sipon or lagnat.
For mild symptoms po, usually naman yan ay lagnat, ubo at sipon lamang. So, for fever po or lagnat, ang binibigay po usually is paracetamol. Then kapag naman po meron kang sipon, meron po tayong mga cough and cold preparations. And let's remember po na itong mga cough and cold preparations na to, maliban sa mga antihistamines at saka yung pang nasal decongestant, naglalaman din po ito ng paracetamol. So, kumbaga, nasakop na rin niya yung sipon at ganoon na din yung lagnat kasi may paracetamol na itong laman. Then, another thing po, pagdating naman sa ubo, meron po tayong, dapat alam natin kung ano yung ubong meron tayo. Either yan po ba ay productive cough o yung ubong may plema, o kaya naman ay dry cough o yung ubong walang plema. Kapag po productive cough o yung ubong may plema, pwede po tayo gumamit ng mga mucolytics o yung pantunaw ng plema tulad ng carbocysteine or ambroxol. If naman po gusto natin ilabas yung plema natin at nahirapan tayo lumabas, pwede tayo gumamit ng mga expectorant tulad ng guaifenesin. Now, kung dry cough naman po, pwede po tayo gumamit ng mga antihistamine kasi di ba usually Makati lang naman yung lalamunan natin pero wala namang lumalabas na plema. So yun po, yung mga antihistamines po nakakatulong para mawala po yung pangati ng lalamunan natin. Another thing is po yung dextromethorphan o yung tinatawag natin mga cough suppressant. So pinipigilan po nito yung madalas na pag-ubo. So yun po, yung mga usual na gamot na pwede nating inumin kapag tayo nakakaranas ng mga mild symptoms ng COVID-19.
Now, when it comes to over-the-counter medicines, Archie, many prefer name brands that they are familiar with over yung mga generic because hindi natin matatanggal yon na may notion talaga na kapag name brand, mas maganda. Meron ba talagang difference between a generic brand and a name brand?
Bilang consumers po, meron po kayong karapatan na mamili kung anong gusto niyong brand na gamot ang iinumin niyo, whether branded or generic. But during this time po na parang nagkakaubusan tayo ng mga branded or yung mga preferred brands natin ng gamot, let's remember po na meron tayong mga generic equivalent. Now, itong mga generic equivalent na gamot o yung generic na gamot po, ito po ay parehas ng active ingredient tulad ng branded na gamot. So for example, yung branded na paracetamol na gusto mo is walang stock, may generic na paracetamol na available at paracetamol din ang laman nito. Parehas sila ng gamit para sa lagnat or pain at parehas din po yung pag-inom nito. Also yung dose nila, kung 500 mg itong paracetamol na branded, may generic din po na 500 mg na paracetamol. And let's remember po na kahit po generic ito, dumaan pa rin po ito sa proseso ng regulation ng Philippine FDA. So makakasiguro po tayo na ito ay safe, effective, and of quality.
Now, apart from ang tamang paggamit ng gamot, importante din ang tamang dami or ang dosage, which also matters significantly. How many times a day, Archie, are we supposed to take these recommended meds? What are some of the things na dapat malaman ng mga viewers with regards to dosing?
Let's remember po na ang mga gamot po ay hindi candy. So pag sumobra po tayo, maaari tayong makaranas ng overdosage. So for example, for paracetamol po, kung nilalagnat po kayo, pwede po kayong uminom ng isang tableta ng 500 mg ng paracetamol every 4 hours. Or kung naman po masakit lang yung katawan niyo or masakit lamang ang ulo ninyo, pwedeng every 6 hours po. And for a day, pwede po tayo mag-consume up to only 8 tablets ng paracetamol which is equivalent to 4,000 milligrams. Now, pagdating naman po sa mga gamot sa ubo, like for example, yung carbocysteine, ambroxol, lagundi, tinitake naman po ito every 3 times a day po for at least 5 to 7 days or kung meron lang kayong simptomas ng ubo. Another thing is po, pagdating naman po yung sa mga cough and cold preparations natin, pwede po kayo uminom nito 1 tablet every 6 hours po. Hindi po 3 times a day, kundi every 6 hours po siya pwedeng inumin.
Now, over-the-counter medicines are generally safe to take for minor health problems. But remember, we still need to be wary about the correct usage as well as yung dosage nito. In one of your viral videos, Archie, you spoke about fake medicine. Tell us more about this and how can yung mga consumers, mga viewers natin, paano nila malalaman kung fake ang isang gamot or legit?
During this time po kasi, dahil nga nagkakaubusan ng mga preferred brands natin na gamot, may mga taong nananamantala talaga. Importante po na maging vigilant tayo at maging observant po tayo sa mga gamot na binibili natin. So, paano ba natin malalaman kung fake ang isang gamot? Unang-una po sa lahat, kung ano, gamitin natin yung mga senses natin. Like for example, yung packaging ng gamot, makikita po ninyo na kung medyo discolored or parang iba yung kulay ng tableta ng gamot or yung kapsula ng gamot. Pag hinawakan mo yung kapsula, parang malambot. Usually po pag maganda ang condition ng mga kapsula, firm yung pagkakagawa ng capsule. Another thing po na let's keep in mind is yung label ng gamot. Meron po kasi yung parang pag kinumpare mo po yung label ng counterfeit or yung fake na gamot sa original na gamot, usually po mali yung placement o kaya may mga marks dun sa label or sa blister pack ng gamot na hindi katugma dun sa original na packaging. And most importantly po pala, bumili lamang po tayo ng mga gamot sa FDA-registered na mga butika.
Now, an infodemic is too much information about something like a disease outbreak. And this includes false or misleading information. As this infodemic problem grows, we'll talk about how content creators can be part of the solution. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. In 2021, the Philippines had the highest social media usage in the world. Filipinos on average would use their phones 11 hours a day. Imagine how much information or misinformation we come across every day. Archie, how do you think we can solve this problem? Ano sa tingin mo yung mga role ng mga content creators katulad mo in addressing itong infodemic na ito?
So sa tingin ko po malaki talaga yung role ng mga content creators and social media personalities when it comes to correcting yung mga misinformation. Dahil binigyan po tayo ng platform or following, so dapat gamitin po natin ito responsibly. Dapat po maging very vigilant din tayo sa mga bagay na sinishare natin. Let's make use of yung mga credible sources. Hindi po yung basta-basta tayo magpo-post ng kung ano-ano na hindi naman po natin alam yung sources. Kasi tandaan po natin na maraming tao ang nakikita yung mga pinopost natin. So let's be mindful and let's use always yung mga na-fact-check na information po.
When it comes to information about medicine, mga gamot, mga vaccine, mga boosters, kung anong dapat gawin kapag COVID positive, at anything when it comes to healthcare, nakikita mo ba, Archie, na marami talagang misinformation online? At gaano ka-importante sa'yo na ma-debunk mo yung mga ganitong klaseng information, ganitong klaseng mga sites?
Actually, marami po talaga ako na-encounter, especially sa comment section when it comes to the vaccines. Magiging zombie ka daw, para mag-iiksi yung lifespan mo kapag nagpabakuna ka. So bilang pong isang health professional at isang content creator, talagang goal ko po is to correct yung mga ganitong misconception. Kasi po maraming tao, very dangerous ito, actually nakakamatay. Kasi kung lahat ng tao ay maniniwala na nakakasama ang bakuna, paano na lang matatapos itong pandemyang ito? So importante po na bilang isang content creator ay gamitin ko yung plataforma ko para gumawa ng mga ganitong content at itama kung ano yung tama. Gumamit po ng mga reliable resources and laging i-fact check yung mga bagay na sinasabi ko online.
Now, apart from information about medicine to treat COVID-19, boosting our immune system and taking care of our health is vital in preventing infection in the first place. Archie, anong marerekomenda mo sa mga viewers natin when it comes to pangpalakas ng immune system?
So usually po kasi pagdating sa butika, ang nire-recommenda ko paggamit ng mga vitamins to boost your immune system like vitamin C, or mga multivitamins po, enough na po yan. But also, let's remember na importante din na kumain tayo ng mga masustansyang pagkain at magpahinga at also mag-exercise po. Mas maganda po yung mga natural ways to boost our immune system. Also din po, sa panahon ngayon, dahil nga may pandemic, one way to properly boost our immune system is by getting vaccinated. Magpabakuna po tayo para may protection tayo sa COVID virus.
Now, before we go, Archie, can you give us a rundown of kung anong mga dapat merong basic sa isang medicine cabinet sa bahay?
So pagdating po sa mga medicine cabinets natin sa bahay, dapat lagi tayo merong gamot para sa ubo, gamot para sa sipon, lagnat. Also thermometer po, importante din na may thermometer tayo. And siguro mga antiseptic natin, mga bandage, mga gauze pads po, para just in case na magkaroon tayo ng mga emergencies or may masugatan sa atin, meron po tayong first aid na mabibigay sa kanila.
Thank you very much, Archie, for being with us today, and thank you for doing your part in helping people throughout this pandemic. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you again next time.